Howdy, this is your Houston Chiropractor, Dr. Tristan coming to you from Advanced Chiropractic Relief in Houston, Texas. And today I'm joined with Miss Nicole. Miss Nicole is a new patient here in the office with us today. And she's coming in today with, unfortunately, a primary complaint of bilateral hip pain. Kind of depends on the day and the activities that you've been doing, on which side's a little bit worse. But she's getting issues on both hips. She's getting some right knee pain, as well as some lower back pain, and also some cervical thoracic pain up here in the region as well, with some headaches also.
Yes.
It's almost a full laundry list that we got going on today, but she found her way into the right office to get adjusted, that's for sure.
Thankfully.
She's had great results with other chiropractors in the past, but this week she did unfortunately see a chiropractor here in the area that she didn't get some great results with, and she actually felt more pain afterwards. So we'll make sure and not do any of the activator techniques for you today. Yeah. How's your experience so far been in the office with the history and exam and everything that we've kind of gone over so far?
So far, everything's been very nice, extremely thorough, comfortable environment, and I'm excited to see the results of this.
Well, let's get started then, okay?
Okay.
So when we're doing the leg length analysis here, she is short on the right by about a ½ inch in this position. And as I bring them up, they actually get even very, very quickly. So right there, they've already evened out. And from this position, as I slowly go up, yep, is it already causing some of that sharp pain there? Mm-hmm. Yeah, since we've already done these, she gets a lot of lower back and hip pain when I bring those legs up there. So we're gonna check that again in just a bit too, and see the differences that we've made. So here we're working on right SI joint. We're working on driving down and away from the sacrum, or the big triangular bone here at the bottom of your spine. Get one more there. This is straight sacrum, S to I. Two more. We're moving to left SI joint. Got one more there. Pressure okay? Mm-hmm. Yeah. Probably a little deeper than the videos you watched, huh? All right.
It is, but it's getting all the spots that hurt.
Yes, ma'am. A couple big breaths there for me. So now we are going to go through the lower lumbar adjustments here, and these will probably be a lot more tender than the ones that we just did. Okay. So after these 4 or 5, I'll give you a bit of a break and we'll work on some of those tight muscles that we talked about too.
Okay.
All the way out, good. Yes, ma'am. Good, another breath. Yes, ma'am. Big breath, big breath, big breath. That's why I said I'd give you a break after those. Patients have called me lots of names when I'm making those adjustments on them, but a liar isn't one. I at least let you know when the tough ones are coming. All right, same thing on this side. Pressure okay so far?
Pressure's good. Back already feels better.
Yeah.
I can take deeper breaths now.
Cool thing is you ain't seen nothing yet. A couple more here on the left, okay?
Okay.
Give you a breather.
Yeah, I'll take my breath away for a second and then start to dissipate.
That's when your brain starts to feel that kind of pain or sore sensation there. It's trained to go into that sympathetic fight or flight response there. Because its initial reaction is to think that that pain is going to cause more issues. But obviously you and I understand that's not what's going on here. We should get the nervous system to realize that. Next we're going to work through the mid-thoracics, okay?
Okay.
Doing okay so far?
Mm-hmm.
All right. Seems like everything's still attached so far.
Yep.
And one more there. Big breath. Just keep taking exhale, 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 exhale. Big breath, big breath. I'll give you a second with that one.
That was uncomfortable, but...
You feel those muscles that try to push back up against you right there?
Oh yeah, it all tightened.
A lot of times when those areas are extra sensitive, I'll start with just 1 or 2 slow, steady pressures there, because that can kind of help the brain understand that, yes, it might be uncomfortable, but it's still a position that does feel good and that we should go through. One more. Shoulders drop and hang, make sure them all sink into the table there. That was a clunker. Big breath, big breath, big breath. Give me another second after that one. Feel those muscles trying to cramp again.
I was going to say those muscles have been tight for at least over a month.
So, if you can see already there on the video, she's now exactly even after those adjustments. So I don't expect this to be 100% just yet, because I still need to do some adjustments for the knees and the hips. But as I bring the legs up this time, it should feel a little bit easier, like we put some WD-40 back there in that lower back.
Okay.
But you tell me. Nice and slow for you. And they stay even there. See, right now you'd already been clinching and fighting against me.
I was going to say, I don't feel anything in the back. but the shoulders are tightened
Shoulders
up
are
now.
tightened up. Yes, ma'am.
But the back where it hurt before feels perfect.
Last time I almost brought you to 90 degrees right there, and you were already jumping off the table. That time we passed 90, and it was just an upper back. So very similar to the lumbar adjustments that you see us doing, the cervical spine also should have a normal lordotic or forward curve to it. And so with the lower back, we use primarily what's called number 11, or the butt crack of our hand here, to contact over the spinous. But for these, we use a hypothenar pad here. One, just because it's a little bit more comfortable. And two, these areas don't need as much force as the lower back. But the angles and everything are almost exactly the same. All right, so this is for AC joints. There we go. And the last two here, these will be for the anterior ribs.
Okay.
And one more there. Table dropped right before I made the thrust. There we go. One more. Yes, ma'am. Big breath, big breath. So next time you put hands on the tummy there for me.
Okay.
As we're into the leg pull adjustment. Is that pain in the hip or in the knee when I?
The hip.
The hip. Okay. Is it when I more so bring it out laterally? Is it
Yeah.
Pinch on the outside there?
All on the inside.
Okay. So first, before the actual adjustment, I'm just gonna do some slow, steady stretches or tractions here to kind of see how the knee and the hip tolerate this position here. Just big breath in. Maybe just a stretch here, not the adjustment yet. Does it increase it for just that one split second as I'm bringing it to the tense position?
As it works through it, and as you let go of the pressure, it hurts, and then it dissipates pretty rapidly.
Sometimes just getting slow, steady stretches can help get those muscles loosened up beforehand. So from that stretched position, it'll just be that short, quick thrust to decompress the knee, the hip, and then you will feel this up into the SI joints and low back too.
Okay.
Big breath, big breath, big breath. Slowly bring it back in.
It's a spot that's been hurting for a long time.
Did you feel it right into those areas that you were getting the sharp pain into?
Yep, still feeling it a bit on the inner.
Is it like muscle contractures right there?
I think it is.
Yes, ma'am. It's gonna be that psoas major muscle right there
Yep.
that we were talking about. Keep breathing. Or just
It's tight, very tight.
Not that same sharp pain though?
No, it's not the same sharpness. It's just tight from compensating.
And being so compressed from all that trampoline and stuff. Huh?
Yep.
Big breath, big breath, big breath. You feel more movement on that side too?
That one felt like more movement because it didn't feel like the muscle
muscles were in
was
the guard.
holding it in place as much.
And that's another reason too that we'll get patients in for a couple of visits at first to get you stabilized, but nothing like the other chiropractor was telling you, or 2 or 3 times a week for a
No.
couple months.
And I anticipated at least 2 more visits with me because of how bad the hip has gotten.
Miss Nicole's also had a fracture on either side of her ankle here, and she's also had multiple sprains on either side as well. So we're gonna get feet and ankles adjusted for her too. There we go. It might feel like I'm ripping them off, but I promise I'm not. Calm down now.
A little numb and tingly, but it's feeling a lot better than what it was. It doesn't feel locked up anymore.
So one of the first things too that I want you to do after leaving the office today is a 10-minute brisk walk as well.
Okay.
A 10-minute brisk walk after having all these adjustments and all these changes made will help get those muscles and that nervous system reactivated into these new adapted positions.
Okay.
Not that old forward flex position that brought you in.
My chicken wing was out. Feels better already though.
Yeah, just like that muscle relax right there. There we go. Get sharp when I get to that one. Yep. I felt
There it goes.
Quick right there. Yep. Boy, boy.
Oh,
That was a really good one.
that one felt good. A good noise for you.
All the kiddos want to get held.
Mm-hmm.
Feel that stretch going through there?
Yep.
Because again, we want it slightly uncomfortable, but not necessarily painful.
It's right there.
So 2 biggest things for this one. Number 1 is just keeping the teeth kind of lightly touched together so you won't bite your tongue off today.
Okay.
Kiddos wouldn't appreciate that.
Nope.
And then number
Should've
2
brought
is
the
that
mouth guard.
number 2 is that same breathing pattern that we've been working on too, and specifically that exhale portion. Because like you've noticed on some of the other adjustments, when I first bring that spine into a tense or traction position, that's when the body thinks, oh no, I've never felt this before, and tries to tighten everything up. So if I feel those muscles tighten up, we'll come back to neutral and reset and start with another one. And go really quick with the exhale too. Right there. Yes, ma'am. You did great for your first adjustment there.
Lower back
Just let go like crazy.
is a spot that has been hurting for years, that always feels like it needs to be stretched, and definitely just got stretched.
Amen. Yes, we're not gonna skip these adjustments, that's for sure. Yeah, one more. That's really tight on the upper right side. That's where those headaches come from. And get a little bit better contact here too. The first one I slipped just a touch on the hairline. We're gonna rotate primarily to the left side. Right there, that's when you'll feel that short, quick thrust. As you rotate, just try to let that left ear fall into the hand, fall into the hand. Yes, ma'am. Big breath, big breath. Yep. Feel that block that we're kind of pushing forward there? So this one's not as much about the rotation. This one's more of just a P-Day adjustment to get that spot moving right there. Don't be surprised if maybe a few times it tries to maybe catch on you or something too, just because it's been like this for a while now.
I was gonna say when I
more
turned
stuff with the chiropractor, but
when I turned to the right, it just locked up, but then calmed down pretty quick.
good, good. So that's why that 10-minute brisk walk is really important afterwards too, to normalize all these new functions that we just put into your full spine and full extremities.
All right.
This is like a massage gun almost, but a little bit different.
My favorite part.
A lot of people don't think this does anything in the videos until they get it in and get it on their spine. So this next portion here, this is a 3-part extension exercise that we talked about doing up against the bed or up against the couch at first, so you don't fall over and hit that head. So part 1, all you need to think about is like a reverse hug. So if somebody was standing behind you, you're not just gonna slowly put them back here. I want you to squeeze, squeeze, squeeze as hard as you can, because that's gonna activate those paraspinal muscles there.
Okay.
So then from that position, as we're squeezing backwards, the chin on this next one, we're not gonna go up just yet. We're gonna take the chin and we're gonna go straight backwards first. It's called cervical retraction.
The best angle.
The weirdest one here. But then from this position afterwards, then you'll go through extension as far as you can. And I'll have you hold it for just a second while I'm making this last adjustment.
Okay.
So part 2 and part 3. Hold it for just a second. One more time. And then you come back to neutral. Yep, and we can relax everything. That's why we have people do that up against the bed and up against the couch at first.
I was gonna say that.
The last thing we'll do here is with the head, I can take it forwards and backwards, just like you did to start today. Should feel like some WD-40 in there.
It definitely does.
That is a huge increase.
Because
in
I
range of
could
motion there.
not move when I first came in.
Miss Nicole, what would you kind of share to the YouTube audience and the crack addicts out there on YouTube land about your first experience here at Advanced Chiropractic Relief?
This has been absolutely amazing, and I've dealt with chronic pains for years. A lot of temporary fixes, and this actually hit spots that have been locked up for many years, like the lower back and all around in the hips. So
how would you kind of describe that first ring dinger? I know a lot of patients watching videos want to know what it kind of feels like, but what would you say is your first initial reaction to it?
it was a lot more intense than what I anticipated, but you could feel it go from the top of your neck, just a quick pull all the way down your back.
Kind of like that zipper sensation that we talked about.
The zipper sensation.
That might have been part of the intermission that you guys missed there on the explanation. So.
So felt like a zipper going all the way down your spine, and the stretch is incredible because it takes your breath away for a second, and then once you breathe through it, I feel like a new person right now.
Awesome.
This is amazing.
Thank you so much for sharing your story with everybody out there on YouTube land. And if you're needing your first ring dinger and want to come in and try everything out that we have to offer here, just reach out to us at Advanced Chiropractic Relief on the website. I was going to say the phone number, but I don't want to get it wrong. So look us up on the website and you can find our phone number from there. Tristan Went coming to you from Advanced Chiropractic Relief in Houston, Texas, with Miss Nicole from the greater Houston area. And we'll probably see you guys on maybe 1 or 2 more videos when she comes in on some follow-up visits as well.